This Father's Day, it's important to give your dad the gift of good health. And to talk about this more, I'm joined by Dr. Veeral Oza. He's a board-certified gastroenterologist here in Greenville. So thank you so much for joining us today.
Thank you, Carrie, for having me.
And I think this is a very important topic because men, they like to put off their health. They don't go to doctor's appointments as often. And something you sent me I thought was really interesting. And I actually want to touch on this first. It's the good news, the positive news about the benefits of being a father. So can you tell me about that and why it's actually good for your health?
Yeah, so there's actually studies to show that being a father compared to not having kids has significant health benefits. So first off, there's better cardiovascular disease profile in people who are fathers compared to those who are not fathers. What that means is, if you think about it, running around kids, you're getting up, sitting down, getting up, sitting down. You're constantly on the move, especially if you have little kids. You're taking them to sports, you're coaching sports, etc. And there's definitely benefits of that translate into your cardiovascular risk profile. Similarly, there's actually better mental health as well, and there's mental health benefits to fathers compared to those who don't have kids. So there's good data out there to suggest that being a father is actually good for you.
And you were even saying before you become a father, sometimes men will put down their bad habits. Explain that a little bit.
Yeah, so before men have kids, there's some data to suggest that they tend to give up alcohol and smoking, which translates to better cardiovascular risk profile. You reduce the risk of hypertension, heart disease, strokes, and all that is directly associated with increased alcohol and smoking.
All right, so congratulations for having kids. It gave you a step up for your health. But now let's talk about the importance of taking care of your health and some of the statistics out there about why men might not go to their doctor as often as they should.
Yeah, so it's very interesting. There's last year, I believe, there was a study that came out of Cleveland Clinic that suggested that 60% of men don't go to a doctor regular basis. So think about that for a second. That's better than a coin toss, meaning 6 out of 10 men don't seek medical care on a regular basis. And there's lots of reasons for that. One is health insurance. Sometimes people may not be insured. Others associated with that is cost. Third reason is there's 40% of the same survey actually said that they were raised to believe that complaining about health care or their own health was a sign of weakness. So there's all these taboos out in society as well that we need to work harder to break.
And then there are certain screenings that you should be getting, every year or every few years. Tell me about those.
Yeah, so there's good data out there that we need to seek blood pressure screening, a cardiovascular risk disease profile, making sure you don't have diabetes, making sure you have no risk factors for stroke. Those are important because those also happen to be the #1 killer in our population is cardiovascular risk disease. Then there's, of course, the cancer screening. You have the age-appropriate cancer screens. The main thing in men is prostate cancer, colon cancer. But then one thing I always feel like is often overlooked is skin cancer. Skin cancer, some people who are spending a lot of time in the sun. Oral hygiene. Going to your dentist regularly is also important. And then after a certain age, getting screened for glaucoma and going to your ophthalmologist on a regular basis, whether you wear glasses or not.
Yeah. And I want to come back to something you talked about, the stigma, and something you were mentioning before we came on was that there isn't as much support around men. When women have breast cancer, it's like you have a whole team of women who are supporting you, whereas sometimes you don't get the same thing with men for colon cancer or prostate cancer. So tell me a little bit about that. Since you are a male, you're a father, tell me what you've experienced and how you think maybe we could change that.
Yeah, so I think there are actually, so to your point, there's actually more support groups that we talk about in the media and just in our society about women's support groups, in situations with men's prostate cancer or colon cancer, there are actually more and more support groups coming up where they talk about and help men deal with that disease, move through with treatments, etc. So there's definitely more in the society that we are doing as a population, and that's a good thing. Along the lines of gender equality, it's not just one-way street. It actually works the other way too for men as well. There's stigma on the healthcare side of things, which we need to break.
And as a father and a doctor, what message would you like to send to other men this Father's Day?
First off, happy Father's Day to all the fathers out there, to your viewers and to your family. But my main message would be that the one thing that you can do for your kids on this Father's Day is to be in a good state of health. So that starts with me. So I've made I make resolutions on Father's Day, but I also make resolutions during New Year's, which everybody jokes about it, that New Year's resolutions don't last forever. But Father's Day is like my midpoint. You know, it's 6 months into the year, kind of renew those resolutions, and that's what I do.
Yeah, okay. So make a resolution on Father's Day, and then maybe if you're the wife or the kid, push your father to go see his doctor,
keep
get
us
those
honest.
cancer screenings. Don't
Yeah.
hesitate. But yeah, overall, I think you were saying before that, yeah, sometimes men are they're hesitant, right?
They're hesitant.
Yeah, explain that a little bit.
So men sometimes, like I said before, they have stigma of actually going and seeking care. Mostly because they, like that same study, 37 to 39% of fathers actually mentioned that they were raised to not complain about their health care, not talk about it very much, because that was considered a sign of weakness. That is something that is obviously changing, but we need to do better to try to break that stigma. So that is one thing that I think we can do a lot in terms of trying to change the mindset of a large percentage of the population who are fathers, that you need to seek care. Because if you find something sooner, you can actually do something about it. You can actually be there for your children. You can actually be a father longer. And be in a healthier, if you're in a healthy lifestyle, you can actually be active with your kids. You can have a good quality of life.
It's a good ripple effect that keeps going.
Absolutely, 100%.
All right. Thank you so much, Dr. Oza, for joining us
you very much for
and
having
giving
me.
some tips for people out there.
Thank you so much.
Mm-hmm.